My name's John Golding. I'm one of the interventional cardiologists here at Erlanger Hospital, cath lab director. Been in town here for about 18 years. Did my initial med school in Nashville at Meharry Medical College. Did my medicine training at Georgetown in Washington, D.C. Did my cardiology at Brown in Rhode Island, as well as my interventional cardiology there. And then after I completed my training, I came down here. In my practice, I focus on coronary artery disease management, diagnostic cardiac caths, percutaneous interventions, and also structural heart disease, specifically aortic stenosis. I think what people need to understand about interventional cardiology is it is a modality or a treatment process to help with the symptomatology of unstable angina or stable angina, especially if they're unable to be controlled with medical therapy. So if you're having persistent chest pain or acute chest pain, this is a possible solution for that problem. So the big thing with chest pain, especially persistent or progressive, is to make sure you get evaluated as soon as possible. The most frequent question I get from patients is really about how do I prevent myself from ending up needing interventional cardiology services. And it's really about, and it's not just coronary artery disease, it's heart failure, it's hypertension, it's hyperlipidemia, it's a lot of healthcare issues. It's really about taking ownership of your lifestyle, your body, knowing your numbers, knowing what your exercise regimen should be, knowing how to do things in moderation as far as alcohol, caffeine, sodium, sugar. So a lot of it, you come see your doctor once a year, twice a year, some people see them 3 or 4 times a year, but realistically, you're living with yourself every day. So you have to have some onus on managing yourself to really prevent yourself from getting to these extreme conditions. I think the most rewarding thing is when you can actually help people, especially when they're acutely ill, and you can get them through that crisis and get them back. You can't always get them back completely to their normal baseline, but if you can, that's really rewarding. Someone comes in with a heart attack, they're in this extreme condition, you can get that, resolved, and then when they leave the hospital, you can work with them and get them back to functioning where they used to be or even better. And then obviously we also like to catch things early in people and try to prevent them from having things like heart attack or heart failure, but I think that's the most rewarding part.